Did you know that you can stop a potentially fatal opioid overdose from happening? Hi, I'm Rob. I work for Jackson County Public Health, and I'm here to show you how you can reverse an overdose using this. This is Naloxone, also known as Narcan. It's safe, easy to use, and can reverse a potentially fatal overdose caused by substances like heroin, oxycodone, morphine, and fentanyl. To spot an opioid overdose, look for these symptoms: blue or gray lips or fingertips, pale or clammy skin, small pinpoint pupils, no response to voice or touch, or slow heartbeat or shallow breathing. If you see these symptoms, follow these 5 steps to reverse the overdose. 1. Call 911 and request emergency medical support. If you're worried about calling the police, you'll be okay. The Missouri Good Samaritan law protects individuals in instances like these who may be facing things like small possession charges or probation violations. 2. Prepare to administer naloxone. Make sure the person is lying flat on their back and tilt their head back gently to open their airway. 3. Insert the tip of the naloxone into the nostril and push the plunger until you hear a click. If you feel comfortable, administer 2 rescue breaths using a face shield if you have one. Make sure to pinch the nose and wait until you see the chest rise to make sure the breaths make it in. 4. Turn the person over on their side and wait for a response. 5. If you haven't seen a response after waiting 3 full minutes, prepare to give a second dose of naloxone. Most boxes will come with 2. Make sure after waiting your full 3 minutes that you use the other nostril in case there was a blockage. You can repeat this process safely every 3 minutes or until help arrives. We at Jackson County Public Health hope you feel encouraged and empowered to spot and stop overdoses in your community. To find your own naloxone kit or for more information, visit jcph.org/opioids.